philosophy before was basically to arrest everyone. Basically, there's a bean counter: arrest, arrest, arrest. And as time went on, we realized we had to change our philosophy. The fact that we cannot arrest ourselves out of this epidemic of substance abuse, specifically opioid overdoses and the deaths related to that, we changed our philosophy to the fact of attempting to get people into treatment. Some of the pitfalls we had with the 911 call and people fearing calling 911 in order to assist someone in an overdose state was the fact that they felt they were going to be arrested. What ended up happening, the legislators changed or tweaked the Good Samaritan law that we now have, which incorporates a portion that states that individuals who call for assistance, whether for themselves, family member, or a friend, will not be arrested for simple possessionary charges of a substance. But the scope of the problem here was really brought to light when the mayor was running for office. There was a new mayor coming in, and his platform was fighting substance abuse. And what can we do for that abuser to make them a better, productive member of society? And it hit upon him in one door that he knocked on, and the family opened the door and they stated, well, what we need is nasal Narcan. And the mayor said, what is that? And from there, we were able to make that blossom into the program that we have now. And the mayor started a drug awareness task force with clergy, the courts, probation, law enforcement, family members, and outreach programs to see what we could do.
We started carrying the Narcan back in 2010, and we started using it right away. We got a call for an overdose at a residence in Quincy Point. A woman's boyfriend came back with her sister from going to the store, found her unresponsive on the floor. My partner and I put the Narcan together, gave her a quick blast in each nostril. A minute or two later, she started coming around. We saw some eye movement, then she opened her eyes, and then she woke up, and she told us that she was just taking a nap.
We did have some issues in the beginning, but it was more so of misinformation. People were misinformed that they thought we were going to be delivering it with a needle-based delivery system as opposed to a nasal spray. And once everyone was educated on that situation, a lot of the apprehension was removed. But still, there were a lot of individuals and some officers that did not believe that that was our primary function, was to administer the drug. And here at Quincy, we're a little bit unique where we have, it is in the police cruiser, it's on our bicycles, the community police officers, it's on our marine units. We have a number of boats that are out in the harbor. So we have it widespread. Basically, I like to say, within an arm's reach of a Quincy police officer, nasal Narcan is available. And through the three-tier system of the police officer showing up, the fire department, and the ambulance, we get to the best service we can for that citizen and off to the hospital as quickly as possible. In the first 18 months of the program, we reduced the deaths by 66%. We've had 260 overdoses that the police department has responded to since October of 2010, when we went live with the Narcan out in the cruisers. Out of those 260, Narcan was deployed 174 times. And out of the 174, 168 were reversed. So phenomenal numbers for the men and women of the police department. And the reason why it wasn't 174 reversed, there were a number of individuals that were already deceased. Someone just didn't feel comfortable calling first. And you know, that we feel bad about. If we were able to get there sooner, we could have reversed that. You know, hopefully, and off to the hospital the individual could have gone. And then in the other ones, the one or two others, they were not an opioid. The Narcan only works on an opioid.
It's a good tool to have. It's another tool in your toolbox. Because, you know, it could be a couple minutes before the ambulance gets there, and then if it's in an apartment building, getting up to the apartment. And so for us to easily just take it out of the glove box, put it in our pocket, go up there, and we're usually the first people on scene. You know, it's an interesting tool, I think, and it's good for fast deployment, too.
Once they're familiar with it, they've used it a number of times, they see the reversals, they get to see something concrete to their actions.
I just hope that it's widely accepted in the areas where there is a lot of heroin use and Class A use. We
received word from a treatment facility. There were two individuals that were in treatment, unknown to each other, praising the Quincy Police Department because they stated to their counselor that they would not be alive today unless it was for the officer that responded and reversed their overdose and got them to the hospital. Some of the benefits of the Narcan program is the reduction of collateral crime, as I call it, which are purse snatchings, breaking into cars, breaking into homes, robberies, all in order to get cash so they can go out and buy the substances. So if we can get some people into treatment, that'll reduce that. Recently, there have been a number of inquiries from around the country of calls wanting to know particulars about the nasal Narcan program here in Quincy. As a matter of fact, as recent as today, I received a call from Florence, Kentucky, and they were looking at trying to start a program there also. California is called, Colorado, New Hampshire, Maine. The calls are just coming in from all over the place that they're interested in this. They want to start a program. They Google nasal Narcan and the city of Quincy pops up. Nationwide, we were lucky enough to be recognized by ONDCP, the Office of National Drug Control Policy, and Director Kolarski. We grabbed their attention. A local police department was able to partner with the Department of Public Health and other human services to come together and recognize that there is a problem and to change our philosophy. As I stated, we cannot arrest ourselves out of this epidemic. And they recognized that, and it became one of the chapters of the President's strategy on the war on drugs in America. 3 to 5 years from now, you'll probably see every police officer trained throughout the country with nasal Narcan in order to do the job of helping people. Another tool in the box.